so you're saying normally 15 years is the life.
Correct.
But we have to keep a check on it.
Right.
If anything goes, we have to change the
Change the implant and
implants.
put a new one, yeah.
Okay. So what is the procedure normally for an implant? Like if I'm undergoing the surgery, what exactly the procedure is, how it will be, how, like an operation theater,
Yeah.
how it will be?
See, what happens is it's done under full anesthesia. So when you go inside the operating room, you get a little IV injection here, and then we connect your ECG monitors just to make sure we monitor you well, and then the anesthesiologist will give medications and put you on sleep or anesthesia.
Okay.
And then what we do is we put additional anesthesia in the breast area, so when you wake up you don't have much pain. Okay. Then we make our incision, we prepare a pocket, we put the implant, we check the shape, we check the symmetry. Once it is done, we close the wound, we put a little dressing. So all in all, it takes about 45 minutes to an hour.
Okay.
After that, within few minutes you are awake, but they will give you pain medication and they will also give you medication to relax and sleep.
What are the general complications which can occur during the operation?
See, one of the things that can occur is during the operation is bleeding, okay, where a person can excessively bleed. It is very rare if we conduct a proper preoperative assessment and examination, okay, because all the factor that causes bleeding sometimes exists inside the body, like thinning of the blood or taking excessive medications, vitamins that can cause more excessive bleeding. But during the surgery, we follow a certain protocol where we make sure that there is not any bleeding, or if there is a bleeding, it's controlled before the operation is completed. So that prevents the risk. Now, bleeding afterwards is also a potential risk. That happens if there is sudden increase in your blood pressure, you get stressed, or you do not take enough care and you do excessive movement, then you could have bleeding. And the risk is usually for 24 to 48 hours, maximum 72 hours. Once that period is gone, the risk becomes very, very low.
Okay. So these are the two normally. And what is after doing the augmentation? I heard there are some cons also. So what is the cons of it doing after augmentation?
What are the risks after, particularly in the first 1 or 2 weeks? Like I said, one is the bleeding where the blood can collect underneath and cause hematoma or infection. Okay. Again, we have to take protocol. So we will start IV antibiotics. We will take all the antiseptic care to prevent that. And it's very rare if it is, protocol is followed. In long run, scar, of course, wherever we make the incision, it may heal with a fine line, or it may form like a dark discoloration, or sometimes a little bumpy scar. So there is a protocol also we will follow for that. We'll advise you to use some silicone sheet, silicone gel to prevent that. Okay. Then in long run, we do recommend you to massage the breast for about a good 2 to 3 months to keep it soft and look natural, because sometimes it causes hardening, called as capsular contracture. But the good thing is when we put behind the muscle, the risk is very, very low with that.
So basically, if I ask you to suggest anyone over the muscle, under the muscle, you would suggest under the muscle as compared more to the over
Yeah,
the
under the muscle definitely has several advantages. Okay, it does have few disadvantages in some individual, and that's why in those individuals we have to put in front of the muscle. But when we are using in front of the muscle, then we recommend them to do massage for a good 5-6 months and do regular checkup to prevent contractures. Again, it also depends on the type of implant that we use. Usually to prevent contracture, there is a specific implant called textured implant, and those implants have less risk of contractures.
Okay. And then what are the post cares after doing the operation? What exactly have to be done?
Yeah. See, what will happen is the first day, of course, you will take rest. You will be assisted by the nurse to go to the washroom and things. Next day, you can move yourself. Of course, first day you need somebody to help you from getting up from lying down position, and then to help you move around. You go home the first day, you eat and drink normally. Second, third day you can do by yourself. You can take shower. Okay. The first day there is a bandage. Second day there is no bandage. You will just have a bra and just a pad. So it's very easy for you to change and shower.
Bandage, I heard. So where is that bandage will be exactly?
Bandage. The first day bandage is all over the breast. Okay, just to apply uniform compression over the breast. Okay. It acts like a garment or like a bra.
Okay.
All right. So it's called surgical bra. Then after 24 hours we remove that, and then we just give you the custom made bra that you will wear.
Okay. Then that means I have to visit again then to do that.
No,
After
first day you will be in the
24 hours.
hospital anyway, so I will come and see you in the hospital and we will do that in the hospital.
Okay.
Once you go back to your home, then we'll call you on a third or fourth day just to inspect.
How is
Okay.
it doing?
Yeah.
Okay. Then next question is like, can anyone go for this? Like, does age affects in any way? Like some people 40 plus or something like that. If even they can go for this implants or something.
See, of course, there is a minimum age limit first.
Okay.
You don't do in a growing girl or a child or a person who has not developed completely. But the maximum age, there is no limit.
Okay.
There are patients at the age of 70 who have done breast augmentation. So there is no, as long as the health is good, they are physically fit, they are suitable to undergo breast augmentation at any age.
Okay. And what is a day before the operation, day after the operation, a week before operation? What are the things I have to take care exactly to avoid
See,
any problem in
That's
future?
right, yeah. See, what we strongly recommend is at least a week before the surgery or 2 weeks before the surgery is to keep yourself fit and healthy, to make sure that you don't have flu, infection, okay. If anybody is, abusing alcohol,
Okay.
smoking, we tell them to refrain and stop doing that. This is the key. Then first day before, we recommend to use some antiseptic wash or shower, okay, proper shower. After surgery care is again a careful shower, okay, and use of pressure garment.
After surgery, careful shower. That is after
Shower is, just like second day you will be able to take shower,
Okay.
but of course you will not use lot of soap in the stitches
Chest.
area, chest area. You will not sit in the bathtub and soak yourself in water. And then you will wear support bra. These are the two most important things afterwards. And take your medications like antibiotics and painkillers and vitamins that is required.
And how many days I have to undergo the medication, like painkillers?
Antibiotic is usually for 5 days.
Okay.
Painkillers, regular basis is about 3 to 5 days. And then afterwards, as and when required.